Here in Rhode Island, there have been 1,521 new cases of the coronavirus since Friday.
The positivity rate is now 6.7%, the highest level since May 12th.
9 more people have died after contracting COVID-19, bringing the state's death toll to 1,233.
212 people are in the hospital tonight. That includes 27 in ICU. 12 News reporter Anita Buffoni is digging deeper into the numbers and joins us now with what the Department of Health is saying tonight. Anita?
Mike and Shannon, it's a lot of the same message we've been hearing from state and health leaders as Rhode Island continues to go through the second wave of cases. The data is headed in the wrong direction. For another week, numbers don't look good.
It wasn't a great weekend from a COVID status.
Rhode Island has reported record high positive case rates, topping 600 cases 3 times last week. Although the data looks grim, Dr. James McDonald with the Rhode Island Department of Health is optimistic for the near future as long as Rhode Islanders keep groups small and wear their masks.
It's still time to get ahead of this. We don't have to have a really bad Thanksgiving and Christmas. We really can get this under control before then.
As it stands, hospitals could reach capacity in the coming weeks if hospitalizations continue to rise. At that point, the state's field hospitals will be used. Dr. Jeremiah Schur is chief of emergency medicine at Lifespan.
It's alarming because we know that by the time we're seeing a lot of cases in the hospital, it means there are many-fold more cases in the community.
And recent data shows Hispanics and Latinos make up 43% of the positive cases in Rhode Island, partly because they live in high-density communities. And it's the 30 to 39 age group that is having the highest test positive rate. With a vaccine on the horizon, health experts say to stick to the guidance to help protect yourself from the virus.
The only thing we can do to safely get through this winter is to wear a mask, keep groups small and socially distanced.
Now, as a reminder, the governor laid out new restrictions that went into effect yesterday to address the rise in cases here, including its stay-at-home advisory beginning at 10 o'clock at night during the week, 10:30 on the weekends, lasting until 5 a.m. I'm Anita Buffoni, 12 News.
And of course, this news comes as Rhode Island is seeing the highest positivity rate and hospitalizations in nearly 6 months.
12 News reporter Anita Buffoni talked to local doctors about the numbers and continues our in-depth coverage. Anita?
Well, Mike and Shannon, this is not a good weekend in terms of COVID-19 data here in Rhode Island. One of the most startling numbers is the daily positivity rate, which is at 6.7% today. And the Department of Health says it could get worse in the weeks ahead if Rhode Islanders don't buckle down and follow the rules. It's the same message that we've been getting from state and health leaders in this second wave. Rhode Island's data is trending in the wrong direction. Take a look at these numbers. There are just over 1,500 positive cases since Friday, the highest positivity rate since mid-May at 6.7%, 9 deaths and 212 people hospitalized. State leaders have warned if this trend continues, the hospitals in Rhode Island could reach capacity. Dr. Jeremiah Schur is the chief of emergency medicine at Lifespan.
As we see things rise, we really hope that as few patients as possible get sick with this so that we don't have to see the suffering that we saw in the spring.
Dr. James McDonald with the Department of Health says contact tracing is taking days to complete, which is longer than usual because of the sheer volume of cases.
People have more contacts, and that doesn't make sense to me because as the pandemic has gone along, we really need to be hanging around less people.
And Dr. McDonald says as the colder weather takes over, it's important to follow the guidance more than ever to help prevent the spread of the virus.
When we go indoors even more, we're going to turn our heating systems on. We turn our heating systems on, the relative humidity in our homes is going to drop, and then the virus goes farther and faster.
Now, the Department of Health says a contributing factor to the high number of positive cases is because a lot more people are able to get tested. In the last 3 days alone, roughly 35,000 tests were administered. I'm Anita Buffoni, 12 News.